All right, good morning, everyone, and welcome to our Dental Health Week. We have had a great week and really, really excited to be here with my guests today because there aren't many of this guy available for us, so we're really happy. Dr. Lewis, thank you so much for joining me today.
Oh, my pleasure, Judy. It's good to see you again.
Yeah. So, and you're sitting in just a beautiful old stone building with the Silo Academy Education Center. We'll talk about that as we go as well. But John Lewis is a veterinarian, and I'm going to read you his bio because he's kind of an amazing person. He's a founding fellow, AVDC, which I'm thinking is American Veterinary Dental College, OMFS Fellowship. There's a quote: "My years in general practice taught me the transformational effect of dental care." And we have talked about that a lot this week. Many pet owners have shared that a dental procedure has transformed their dog or cat into a youngster again. Specialty training taught me the finer points of life-saving procedures, such as removing oral cancers and jaw fracture repair, and these are some of the most rewarding cases. The great thing about veterinary dental specialties is our uncompromising patient care. Each patient receives the best care in the finest facility from the best staff and world-renowned specialists, and I can attest to that because I've been there. So Dr. Lewis is past president of the American Veterinary Dental Society. He graduated from University of Pennsylvania School of Veterinary Medicine in 1997. Oh, he's just a baby. And spent 5 years in general practice prior to returning for a residency in dentistry and oral surgery. He became a fellow of the Academy of Veterinary Dentistry in 2004 and a diplomat specialist of the American Veterinary Dental College in 2005. Man, you like to take tests. Dr. Lewis is past president of the American Veterinary Dental Society, and he is active on various committees of those societies. At the University of Pennsylvania, he served as associate professor of dentistry and oral surgery, associate director of the Mary Lowe Center for Comparative Oncology, wow, and chief of surgery. His clinical interests include endodontics, feline tooth resorption, I should bring my kitty up, feline stomatitis, oral surgical oncology, non-invasive jaw fracture repair, and lasers in oral surgery and dentistry. When not treating patients or teaching veterinary dentistry and oral surgery, he enjoys spending time with his wife, 6 sons, I met a few, 2 dogs, and 2 cats. So John, again, thank you so much for agreeing to come educate us today. You live in the most beautiful setting, and when we came there with my mother's dog a couple summers ago, we pulled up and there's this beautiful old farmhouse that I know you've been doing a lot of work on, and then is your dental building, the practice building, is that a redone barn, or did you build that from scratch? I mean, it's got stone walls, so there was something there.
Yeah, it's an old barn that we can't take credit for the entire restoration because there was a major restoration done on it in 2014. I purchased the property in 2018, but in 2014, the barn was converted to a winery, and they did some major restorations of the barn. There was a wine bar downstairs, a wine bar upstairs, and they did a really nice restoration. Unfortunately, the winery went out of business after a couple years, and then it was just a bank-owned property that sat there from about 2016 to 2018. And so we were looking to try and set up a practice in the Chadds Ford area. It's just such a beautiful area, and I always remember it as I drove through that area to go to the large animal facility of Penn's veterinary campus in Kennett Square. And so when the opportunity arose to create the second location for veterinary dentistry specialists, Dr. Rice and I, who are the co-owners of the practice here, decided that this might be a good location. And so, yeah, we stumbled across this wonderful facility here, which is great for helping patients upstairs and teaching veterinarians and veterinary technicians downstairs. So it's just a perfect match for what I was looking for.
Exactly. So at the Silo Academy Education Center, that's the downstairs, and so that's where you are right now, I'm assuming. Um, Who do you teach there, and how often do you teach there? It's probably changed with COVID, but
Yeah, there was a while there with COVID that we weren't doing anything, but we're back up and running and teaching a lot of veterinarians, general practitioners, mostly dental techniques, extraction techniques, um, and also technicians. We have what we call a tooth camp, which kind of is our form of boot camp for technicians, where they go through various stations, learning how to diagnose and treat periodontal disease, learning how to take dental radiographs, and learning how to do nerve blocks. And so it's a nice day-long intensive course for the technicians, and we offer that probably quarterly, along with the extraction techniques in dogs for the primary care veterinarians. And this year we're going to be offering some other options as well, including feline dentistry wet lab, an intermediate level for those who have taken our previous wet labs and want to do something a little bit more advanced, and really advanced stuff for diplomates, like oral and maxillofacial surgery stuff. And even we're branching out into other areas of veterinary medicine. We have an ophthalmologist who's going to do a wet lab on ophthalmology techniques. That's probably going to happen in May. So it's going to be probably a big year for us, after a couple of years of slow years due to COVID.
And now you're on the treadmill running to catch up as fast as you can. Exactly. But it's so critical because I think in veterinary school, I'm a dinosaur. I went a long time ago, but I don't think that there is enough time spent on dentistry. So unless you really have an interest in it and you're a general practitioner, it's sort of like, okay, yeah, I can do simple extractions. Maybe I can, cut a big molar in half so that I can get the 3 roots. But it's not something that is really focused on. So I think being able to get some education from someone who has such a high level of dental knowledge is really important. So one of the discussions, and we're going to talk about all the really cool stuff that you guys do, but I want to talk about general practice for a minute. And one of the discussions that comes up quite often on social media is, I would never allow a technician to do the dental cleaning on my pet. I only want the veterinarian to do that. I want to hear your take on that, because I always told people, you don't want me doing the dental. You really want my technician with 25 years of dental experience doing this, not me. But I want them to hear it from you, what your take is on that.
Yeah, we have various levels at which different peoples of different levels of education will do things. So we have the veterinary dentists do the extractions, of course, and in some states that's a requirement by law. I think the extractions are something I would never ask a technician to do, just because of the fact that there's just so many things that can go wrong with an extraction that it's tough to put someone in that position, particularly, if they haven't had the exposure or education to do it properly. And so extractions are something that the veterinary dentists will do, or in general practice, what the general practitioner will do. And then I think here we have various levels of technicians as well. We have what are called VTS technicians, who are specialized in a certain area. We have a VTS technician in anesthesia. We have a VTS technician in dentistry. So they're focused more on those particular areas. And then we have technicians that are certified, but they are not specifically specializing in a certain area. So those are ones that will do a lot of different things. But I think that I agree with you that if you have a well-trained technician that you've overseen and know that they do good work, then that part of the anesthetized procedure, including the cleaning and the polishing, is something that is well within the reach of a technician to be able to do. And we teach, them to learn how to chart properly and to write things down on a chart so that we can document it for the future, and be very thorough about, the oral examination. Because I think in many practices, technicians are kind of the first line of diagnosis, and they're going to be noticing some things that they'll bring to the attention of their doctor, who will decide, how best to treat.
Right. Yeah. So, and one of the things we talked about this week was as the pet owner asking questions. Who's doing the procedure? What is their training? What's their experience? What's their background? Who's overseeing everything? So I think a lot of it is just a communication level of knowing whose hands your animal is going to be in.
Right.
So at the Veterinary Dental Specialty Center that you're part of, which I think now there's 3 locations, right?
Correct. Yep. We just opened our 3rd location in Katy, Texas, last week.
Texas. Okay, so we've got New Jersey, Pennsylvania, and Texas. Interesting. So you guys are really unique because not only do you have a board certified veterinary dentist, but you have board certified veterinary anesthesiologists. And first of all, I think getting a board certified dentist and a board certified anesthesiologist, there aren't that many, hard to find. And then, getting 2 under the same roof, that's got to be hard.
Yeah, it's a challenge. There's only about a little over 200 board certified veterinary dentists throughout the entire country. And there's probably only about 300 anesthesiologists or a little more than that. So getting 2 of those in the same room is a challenge. But when you do, it works very well because I can focus on the oral surgery aspect of things and they can focus on the anesthesia. And a lot of these patients that have dental problems have a lot of comorbidities, be it heart disease, kidney disease, combination of the 2, diabetes, could be, a lot of patients where we're weighing the risk versus benefits of putting an older patient under anesthesia. And so we want to try and do everything we can to have a good outcome.
How often do you turn a pet away and say, no, that there's no way they can have anesthesia?
Yeah, there's occasional cases, but it's pretty rare. And often it depends on what my anesthesiologists think, but also what the other specialists that are involved in the care of that patient say. Like if it's a patient with really severe heart disease, like I just reached out to a cardiologist yesterday and said, okay, so the owner had mentioned that this patient should probably not undergo anesthesia. Is that a relative contraindication or is that a definite contraindication? And he said it's a relative contraindication, and it depends on the risk benefit ratio, So a lot of times we have to kind of try and just provide as much information as we can to owners to make a decision about whether or not they want to take that risk, and thankfully, a lot of times when they do take the risk, they're happy they did. As you had mentioned when we were talking just when we were setting up about a patient that came all the way up from North Carolina to see us because their pet had some significant heart disease, and thankfully everything went well with that case.
Yeah, and so interestingly, because practices like yours are few and far between, you get patients literally from all over the world.
Yeah, it's not uncommon for clients to travel long distances. So it's nice that we're set up in an area where it's a lot of history in this area, a lot of things for people to see and do when they come to this area. Longwood Gardens is literally a couple miles down the street, which was, I think, voted last year as the nicest botanical garden in the United States. So there's a lot of things for people to do when they bring their pets here. And usually they'll come in the day before and find a pet-friendly hotel or a bed and breakfast and make a day 2 or 3 of it.
Yeah, which is very cool. When we lived about an hour and a half away when we brought my mom's dog up there, but I was so glad that we did. And my mother, for those of you who weren't following me when all this was occurring a couple of years ago, she had a 50-pound standard Schnauzer who at the time was 16. And she called me at work one day, or actually my husband called and said, hey, your mom's dog is bleeding all over the kitchen. It seems to be coming from her mouth. So I said, all right, run the dog over to the clinic. And she came over and she had a hole in her jaw that was just pouring blood, a little pinhole. And so I said, well, there must be an abscessed tooth under there, but she had this weird condition where all of her gums had overgrown all of her teeth. And in the long run, what we discovered when the dog came to you was that not only had the gums overgrown her teeth, but she had grown new bone around all of her teeth. Do you see that very often?
No, that was a weird one. But there was a number of things that we found on the biopsies in that area, and one of them was some osteomyelitis, maybe due to a bad tooth, like you had suspected, with a tooth root abscess that caused some infection of the bone. But it was not just lysis of bone; it was proliferation of bone and soft tissue as well. So yeah, that was an odd one, but we see some interesting stuff. But that was a rare one.
It was quite unusual, and the dog ended up needing blood transfusions during the dental procedure because this thing was such a mess. And frankly, she needed work done in all four quadrants of her mouth. And I think that day you got through one or two that were the worst, and said, well, we'll see what happens. And luckily she did well enough for another year and a half that we didn't have to go back and dig out more bone and tooth. But and these are the kinds of cases where it's like, okay, like as a general practitioner, I'm looking at this going, like, I can't find where the tooth root ends and the bone start. It was so weird. I felt bad for my technicians who were trying to help me dig teeth out. They're like, I don't know where the root is. I can't find stuff here. So what kind of, I mean, obviously restorative surgery for cancer, broken jaws, that sort of thing, which is very cool. I didn't even know you did all that stuff. What kind of advanced dental procedures are options? Let's say somebody has a dog who breaks a tooth, but the tooth is still solid in there. It's got a good root system. What kind of options do we have other than just saying, well, I'm going to have to go, start yanking teeth?
Yeah, we do a lot of root canals for broken teeth. And I think it's worth mentioning that, ever since antlers became popular, we see a lot of broken teeth. So it's important to
Thank you.
not let your pet chew on antlers, or even I've seen a lot of fractured teeth on real bones and nylon bones, and even things as innocuous as an ice cube they can break a tooth on, because the jaws are so strong that if they just wedge it back between the teeth just the right way, it can cause a fracture. So it's usually the big upper fourth premolar, that big upper three-rooted tooth in the back, or a canine tooth. And so those are more functionally important. So a lot of owners will seek us out to have root canal therapy done on those teeth. And it's a successful technique. About 90 to 95% of the time, it will provide a long-term success for maintenance of that tooth. And basically what you're doing with the root canal is taking out the nerves and the blood vessels in the center of the tooth and replacing it with an inert material, which hopefully won't allow for future infection. And so it's a nice, elegant way, rather than taking out some of these really big teeth that make up a large portion of the jaw. It's a lot less to put a patient through. And it's not always an option. Sometimes it's a game time decision that we have to make a judgment call on. Sometimes we have to fall back on doing an extraction. But in some cases, it's a really nice, elegant way to deal with a broken tooth.
Great. And do you like, I've occasionally seen some of the bigger dogs that'll come in with a silver tooth or a cap. Do you do that often?
Yeah, mostly for police dogs. We just had a couple of police dogs that came in. They fracture their teeth sometimes while they're doing bite work when they engage the bite sleeve. And some of them will chew on the bars in the back of the patrol car, and that'll kind of weaken the tooth. And then when they do some bite work, that kind of finishes off the canine sometimes. So so we do try to save those canine teeth in the police dogs by doing root canals. And then because we know they're going to be going back to bite work shortly after that, we put a titanium crown over top of them, and that seems to prevent future fracture. And so we do our fair share of those, mostly in police dogs. We don't do a lot of tooth colored crown restorations in pet dogs, because a lot of times if the tooth is fractured off, it might be smaller, shorter, and stable enough for a pet dog that we don't have to go through the additional anesthesia to put a crown on there, because it does require at least 2 anesthesias to do the root canal and the crown preparation, and then you have to bring them back to cement the permanent crown on there. So so it's something that we have to send our impressions out to a laboratory. They make a crown just like they would for a human, and then we cement it on. So a lot of things are very similar to what you would experience on the human side.
Very cool. But yeah, for somebody who's traveling a few hours to get there, they have to do it a few times. It's a little tricky.
Yep. So it's a judgment call.
How how many, I mean, you guys have three of these, so, we got 3 states covered. How many, do you have any idea how many specialty practices like yours that there are throughout the US?
Yeah, well, there's, I think I just submitted our annual report to the American Board of Veterinary Specialties, and we are up to, I want to say, about 208 diplomates now, and some of them work together in one practice, and some of them work in academia. But in terms of standalone specialty practices that are just doing dentistry, I would say there's not a huge amount. I'd say maybe throughout the country, there's maybe about 50 or 60 would be my guess.
Wow.
But yeah, I think the ones that are existing may have multiple board certified veterinary dentists, and obviously academia is slowly but surely taking on more veterinary dentists because of, as you mentioned earlier, it's something that has been kind of neglected in the curriculum for a long time. And it's the veterinary students that are really bringing it up to the faculty and the administration and saying, hey, I've spent some time in general practice before I came to vet school, and I know how much dentistry I'm going to be doing when I get out and practice. So I need to learn about it. And
Yeah.
so it's kind of a grassroots effort from the students that are really making advances in, hiring board certified veterinary dentists into academic positions.
Wow. That's good news.
Yeah, it's a slow process, but it's, I think that, it's something that, the AVMA and all the veterinary colleges are paying more attention to. In fact, the AVMA just released something, I believe, last year requiring that veterinary students get education in dentistry to some degree. May not be as much as we think they should get at this point, but it's a start.
That's good. That's really good
Yeah.
because, I mean, I was in New Jersey before, where there's a specialty center literally on every corner. Very few of them had a board certified dentist. So I was really happy when you guys opened up. And now I'm outside of Raleigh, North Carolina, and we have specialty centers. Stone's throw, you can find one. It's not hard to find a specialty center, but it is hard to find a veterinary dental specialist. And I'm not aware of any practices that have both an anesthesiologist and a dental specialist on board. So, and it really is, having spent so many years in general practice, my technicians that had so much experience, I always trusted them to be running the anesthesia, charting, monitoring, and really keeping everything under control. But I've been to a lot of practices where they don't have that level of technician that can really keep track of things. So as the doctor, if you're trying to do a complicated surgery or complicated extraction, and you're also having to worry about what's going on with the anesthesia because you don't have someone at a high level to monitor that, it can be a little scary and challenging. So I'm really excited about your education center. I'm really glad that that's back up and going. How many veterinarians and technicians would you say have gone through your program there?
Well, we had our first event back in, let's say, October 2018. So that was even right before we opened up the veterinary dental clinic. And so I would say we're doing less numbers of people per session or per event this time, just because of COVID. We're trying to space them out a little bit more.
Right.
But we've been doing it probably quarterly since 2018 with it used to be about 16 doctors per session and about 24 technicians per session.
Nice.
And now we've backed it down to about 8 to 10 doctors per session and about 21 technicians per session. And so yeah, I think if I do the math, it's getting up there into the hundreds at least. So that's good.
Which is great. And is that mostly local people who come in for that, or are you getting people from longer distances?
Yeah, it's a lot of people from Pennsylvania, New Jersey, Delaware, but we've had someone come in from Oregon. We've had someone come in from West Virginia. Some people from up in northeastern areas like Massachusetts. So it's a variety, but mostly local folks. But I think some of the companies and the reps of those companies who provide some equipment for the wet labs are getting the word out in other areas where they travel. So that's been helpful.
Yeah, that's great. The more people we get educated on this, because one of the statistics that I found for earlier in the week when we were talking about things is that dentistry or poor dental health is the number one problem in veterinary medicine right now, which, we all think about, oh, it's cancer, it's allergies, it's, chronic inflammatory disease, but no, actually we need to start in the mouth because it is a huge problem.
Yeah.
What do you recommend for home care? We've been talking about brushing every day being
Right.
the gold standard.
Yep.
And I saw a statistic. Oh, somebody posted something on social media today and said 3 times a week is the bare minimum for brushing your pet's teeth or taking care of them. And I think about if I only brushed my teeth 3 times a week, I would not be a happy camper.
Yeah, and you can imagine how if you went like 15 years without brushing your teeth, how bad things might get in there, right? So it is something that sometimes we are happy to see that they're brushing at least every other day, but I think that it only takes about 48 hours for plaque to start to mineralize and turn into tartar, which won't brush off like the plaque does. So if you can stay ahead of it once a day, then you'll be much more effective in your brushing. And you're right, by far the most effective and the least expensive way to keep those teeth is to brush the teeth. And nice soft bristle brush. Start off with just some warm water on the brush. It's more important of what the bristles do than what you put on the bristles. And then work up to maybe putting some enzymatic toothpaste on there. Or in patients that have established periodontal disease, maybe you could squirt a little chlorhexidine rinse on there, and a very dilute version of that at like 0.1%. But I think that the mechanical effect of the bristles, and particularly the bristles kind of sweeping the gum line, and the gum line is where the tooth and the body interact, and so that's where you're going to have the potential for bacteria to migrate into the deeper pockets and to be able to gain access into the body. In fact, people that have periodontal disease develop a bacteremia pretty much every time they eat. Just the act of chewing on something pushes plaque and bacteria up into the bloodstream, and you get a transient bacteremia in the body for no more than a half hour or so, and the spleen and the immune system takes care of it, and then it's gone. But that chronic shedding of bacteria into the system can have some effects on the organs long term. It's pretty amazingly rare to see like an acute onset of systemic disease from dental disease. We see such severely diseased mouths, and I'm amazed that we don't see more like vegetative endocarditis and that type of stuff. But the things that I think are more likely are kind of those chronic effects of every day getting a bacteremia and having the effects on the liver and the kidneys and the heart that may result in some of these chronic changes that we see in older pets.
Yeah, we have so many pets that are suffering with chronic inflammatory disease, and I think that a lot of it starts in their mouth. And as you said, it's filtering through the kidneys, filtering through the liver, filtering through the heart valves, and then we end up with secondary problems. So with that bacteremia, so for instance, I've had a couple of cases recently where these were dogs, chronic UTIs with some nasty things growing in there. Mm-hmm. But these are also animals that have really nasty dental disease that everybody's too afraid to put them under anesthesia with all of their issues. So in your mind, how closely related is that infection in the mouth and the chronic UTIs that keep getting more and more resistant?
Yeah, that's really the $64,000 question. It reminds me of a patient I saw last week. His name was Zebedee. He's a 17-year-old Boston Terrier, and he had really severe periodontal disease, a loose lower canine. And to have a canine that's loose, there's a lot of periodontal disease going on there because it's such significant amount of attachment structure to the root system of that tooth. And when I touched that tooth, he winced a little bit. So we're going to get him in here to get that dealt with and some of his other dental issues. But on his blood work, it showed an elevation in his BUN. which was not there previously. And so we did a urinalysis, and sure enough, he had a urinary tract infection. And so, so whether or not that's directly related to that chronic shedding of bacteria from the oral cavity, we really don't know. But I think that, the goal is to try and take away any chronic source of infection in the body, because we know that's not good for a patient. And if the urinary tract issues resolved, then that's a wonderful bonus. But sometimes they may, sometimes they won't. It just depends on what the inciting cause of those UTIs are.
Exactly. Non-anesthetic dentals. What's your feeling?
Well, I think that no self-respecting dog or cat is going to let you get underneath their gum line while they're awake. I think that the two most important tools that I use during a dental examination, an anesthetized dental examination, is dental radiography and periodontal probe. And I can't use either of those in the awake patient. And so, for them to get dental x-rays, they have to be very still, and they have to hold a film or a sensor in their mouth, and they can't move. And so that means they have to be under general anesthesia. And in many ways, I feel like general anesthesia is safer than a deep sedation, because you can put them on a light plane of general anesthesia. You've got a protected airway. They're getting 100% oxygen, and you can breathe for them if they're deciding not to breathe transiently, So I think that general anesthesia has a little bit of a stigma attached to it that I feel like, I think we should be more worried about the deep sedations rather than the light planes of general anesthesia. And there's some things we can do to make sure we maintain as much of a light plane of anesthesia as possible, like doing nerve blocks for oral surgery. Even though they're under general anesthesia, we still do nerve blocks to numb up the area. And we use a long-acting form of Novocaine that will allow for post-operative pain relief as well. So it has kind of a dual bonus of trying to minimize the amount of gas anesthesia that they need to see during the procedure, and providing some post-operative pain relief as well.
Yep. Yeah, I agree. One of the statistics we talked about this week is that 75% of dental disease is below the gum line. Yep. So without those radiographs, without that sedation to be able to get down there and see what's going on, it's cosmetic at best. Exactly. Is my feeling. So, and I was speaking at a national conference and said that, and boy, did I get attacked. No one, because it was a natural pet health conference, so nobody wanted to hear that their animal had to have anesthesia.
Nobody wants to put their pet under anesthesia, but sometimes it's a necessity. And I just did a dental procedure on my niece's cat yesterday. Her cat's name is Catherine, and she had some subtle signs of some possible oral discomfort. So she and my sister, who live out in Michigan, drove in from Michigan to get their cat's teeth dealt with yesterday. And obviously nobody wants to have to put their pet under anesthesia, but when you do, you get such a better feel for what's going on in the mouth, and you can treat appropriately. And I took Rachel, who's my niece, one is talking about maybe toying with becoming a veterinary dentist. So I videotaped some of the procedures that we did. She had a couple of tooth resorptions that we had to take out yesterday, and as I was showing Rachel the videos yesterday, it was impressive to me how much finesse it takes to get out a premolar in a cat, and something you don't notice on a daily basis when you're just doing it. But it's one of those things where if you try to do some of this stuff in a patient that was sedated or awake, it would end very badly. So I think that the anesthesia is such an important role, and it's just one of those things where we just have to kind of assess each case individually and try to provide each pet owner with as much information as they need to make an appropriate decision, and trying to minimize the risk in any way we can.
So somebody just asked a question: how often does a complete dental need to be done? And clearly every animal is different, and it depends how much home care is being done. But what's your general take on that?
Yeah, so I think that I don't tend to give a specific recommendation across the board, because it may be very different for a large breed dog versus a small breed dog, maybe very different from a cat and a dog. But I think that in general, a yearly thorough oral exam is a good thing. And whether or not that's starting off with an awake exam, if the patient is cooperative enough that you can get a good look in there. But I think that most patients will develop enough plaque, tartar, and possibly gingivitis over the course of a year that they may benefit from a cleaning. Obviously we want to try and extend that time out in between cleanings as much as possible, just so we can minimize the anesthesia times that they have to undergo, because even though we try to minimize the risk, there's always at least a small risk with anesthesia. And so if we can find that balance between kind of staying on top of what's going on in the mouth, but still trying to get as much mileage out of each dental cleaning, I think that's key. But in general, if I had to say a ballpark, I'd say once a year, especially in those patients that aren't going to give you a real good look in the awake examination.
Yeah, all those brachycephalics that you can't get your eyeballs on those back teeth no matter what you do.
Yeah.
I own a few of those.
There's probably a bad molar in there somewhere, right?
Oh, God. Yes. Kitty cat resorptive lesions. Is there anything that can be done with those other than extraction?
Yeah, this disease has always fascinated me. I did some studies on it when I was at the University of Pennsylvania. My mentor, Dr. Alex Reiter, was really big into studying this as well. And he did a study that looked at vitamin D levels in cats that had tooth resorption and cats that didn't. And he found that there was a statistically significant increase in the amount of vitamin D in the bloodstream of cats that had tooth resorption compared to cats that did not. Both groups were still within the acceptable normal range of vitamin D in the bloodstream. So, it's a very well conserved system with vitamin D and calcium and phosphorus and that type of stuff. But I think that that's something that, definitely is interesting because of the fact that cats cannot synthesize vitamin D from the sun like we can. So their only source for vitamin D is cat food. And if you look at the amount of vitamin D in certain cat foods, particularly canned cat foods that have a lot of fish and fish oils in them, there's a much higher vitamin D level than what the requirements for vitamin D are. And it's not that the companies are putting vitamin D in the food. It's just that cats really like to eat certain things that happen to have a lot of vitamin D in it, and so to make foods palatable, there's often a lot of fish or fish oils in them. So there's still a need to do a long-term feeding study with patients that have a certain amount of vitamin D and a larger amount of vitamin D, and see if there is a correlation there with the development of tooth resorption and vitamin D. So it's still not proven. There have been studies since Dr. Reiter's study came out that have kind of found the different findings, but I think that it is something that raises a lot of questions, because if you look back at previous histologic studies on when they did a lot of experiments on exposure to excessive amounts of vitamin D in experimental animals like dogs and rats and mice, the changes with the teeth were very similar to what we're seeing with changes in the teeth with cats. And the thought is that perhaps vitamin D is playing a role with mineralization of the periodontal ligament, which is that soft tissue barrier that separates the tooth from the bone. We know the bone should remodel. The osteoclasts and osteoblasts are responsible for allowing the bone of the jaw to remodel based on the forces placed on it. And remodeling is a good thing in the bone. But the teeth should not normally be remodeled. Once they're fully formed, then that soft tissue barrier of the periodontal ligament should prevent those cells that remodel the bone from starting to eat away and remodel the teeth. And I think that may be what's going on there, where we're getting, for whatever reason, mineralization of the periodontal ligament space, which in turn affects the body's ability to tell what it should remodel and what it shouldn't remodel.
That is very interesting. And as you're saying this, and I'm thinking, so I've got 3 indoor cats and 4 out barn cats, and my smallest indoor cat, it's a brother and sister. She's 5 pounds. He's 15. I mean, they're totally opposite. She's got a parrot mouth. I mean, she's a mess. But she is getting resorptive lesions. They're about 12 years old. Okay. She's my fish eater.
Okay.
Like if I put out, a thing of pork and a thing of fish, she's always going for the fish. Now I'm just going to take her fish away. but I have to get her tooth taken out. Jeez.
Yeah.
Okay.
So there's other theories as well out there. Vitamin D theory is not the only one, but I think that in my mind, that's the one that holds the most weight right now.
That's very interesting. So, because one of the things that I talk about a lot is having people test their animals' vitamin D levels, because we find, particularly in dogs, so many of them have low vitamin D levels.
Okay.
Because the vitamin D just doesn't last very long in processed food, and it has to be added back in. But a lot of these animals, even when they're on really, I'm a raw feeding fan, or gently cooked, but a human grade food fan. But these animals that are on these really high quality diets that, on paper, you look at the analysis, there's plenty of vitamin D in there, and then we test them and they're low. And we find that particularly in animals with heart disease, cancers, that the vitamin D levels, dogs I'm talking, are chronically low. And so it's really interesting that the kitty cats are kind of having problems on the other side of the fence.
Yeah, that is interesting. And in terms of like the foods that tend to have on the cat food side, there was a study that was once done that looked at amounts of vitamin D in cat foods. And I guess that's probably in cat foods that were recently created. So I don't know how it changes, in the cat foods over time once they've sat on the shelves for a while.
Right.
But one study that looked at the amounts of vitamin D in cat foods, I think the requirement by AFCO is like 250 international units per kilogram dry matter. And some of these canned cat foods that were fish-based had in excess of like 20,000 international units per kilogram dry matter. So a lot more than what they would require, at least according to AFCO standards.
Kind of surprising that it's only their teeth that are going bad and not their kidneys.
Well, maybe some of this chronic kidney issues that the cats get might be, related to that as well. Who knows? But yeah, it's something that I think some feeding trials ultimately will need to be done to really be able to, see if there's a cause and effect relationship. But it has to be in an environment where no other variables are different, which is tough.
Right. Yeah, those studies, when you're using live animal studies and you have to kind of go a lifetime,
Right.
You're setting up a 20-year study.
Yeah,
it's very difficult.
Not inexpensive. Yeah.
Yeah, very difficult to do. What have we not covered that you want people to know about?
Well, I think we covered a lot of good topics. I think we talked briefly about oral tumors, and I think one of the things that my technicians one of my technicians who worked in general practice for 33 years, and she became a VTS in dentistry. But until she came to work with us here in Chadds Ford, she didn't realize how much could be done for patients with oral cancers. And so she's been really impressed at how amazingly well all these dogs adapt after having an oral tumor removed, be it due to, by removal of a portion of the mandible or the maxilla. Seems like, it's always a judgment call based on the individual patient, but a lot of these dogs are eating the night of or the day after surgery. Cats are a little bit different story. They tend to bounce back more slowly, and sometimes that has to affect our decision about whether or not to put a cat through a major surgery like that. But we had a run of oral tumors lately, and it's always great to see them come back at the recheck and see how well they're doing. They might have a little bit of a different appearance cosmetically, but they don't look in the mirror and say, wow, I look a lot different than I used to. And they seem to adapt a lot better than we probably would from a similar surgery.
That's amazing. So if you're doing, let's say removing half of a lower jaw or something, are those animals typically also getting chemo, radiation, or, I know every case would be different, but are there many that it's surgery is the only thing that's done?
There are, particularly with certain tumor types. Like we've had 2 patients that came in last week that had acanthomatous ameloblastoma, which is a mouthful, but it's basically a aggressive tumor, but it's technically a benign tumor because it never spreads to the lymph nodes or the lungs. So that's a nice one. If you have to have a tumor in your mouth, that's a nice one to have, because of the fact that if you can get clean margins on it, then you can fix the problem once and for all. And so So we've had, luckily, both of those patients who had acanthomatous ameloblastomas on their maxillas. We did maxillectomies on both of them, and both of them just recently had the margins come back as clean. So that was good news. And so they should be done. They don't need radiation. They don't need chemo, but it depends on the tumor type. Like if it were an osteosarcoma with the potential for metastasis to the lungs or elsewhere, then we always recommend in cases like that for after they get clean margins on the primary site to seek out a medical oncologist to be able to see what they recommend in terms of chemo or other options.
Great. Great. Yeah, I used to see quite a few cats with squamous cell carcinomas.
Yeah, they're still pretty frustrating. We do occasionally get a case that we find at a small enough size that we can recommend surgery. But even when you do get clean margins on them, there's about 12% of cats that won't regain the ability to eat or drink again on their own after having a big surgery like that. So they don't tend to bounce back quite as reliably as the dogs do.
Interesting. Because usually, you say you can do anything to a cat and they just keep right on ticking. But
yeah.
So now we found an area where the dogs win.
Yeah, I think a lot of it has to do with how important their tongue is for function. In terms of the way they use their tongue and just the act of like drinking. When dogs and cats drink, their tongue comes out of their mouth and it forms a little ladle, and they grab some water and then they drop it into their vestibule, their mandible. And so in some of these cases, that's not there anymore or not normal anymore. And so it's a learning curve. And depending on how food motivated the particular patient is, that plays a big role too.
Yeah. Yeah. I think dogs are more food motivated than cats.
In general. Yeah.
Definitely. Oh, man. So what you guys are doing, I'm so impressed. I'm glad that you're opening up more centers. We need one in every state. Well, maybe not Delaware because you're close enough, so they're okay. But we need these at least regionally, so that people have an option. Otherwise, folks, jump in your car and take a drive. Totally worth it. Veterinary dental specialist. So if somebody just has an animal that just needs a dental, nothing special, do you guys do those?
We do.
I mean, nothing special that we know of going into it anyway.
Right. We do have some clients that are, so concerned about the anesthesia that they seek us out more so for our anesthesiologist than for our dentist. And that's okay. I think, it's something that it depends on, the individual patient and the client. A lot of clients will understand that it's probably a lot less expensive to have a dental cleaning done at their primary care vet than to have it done here. But some clients like the satisfaction of having, up to about 4 specialists working on their pet between the doctors and the nurses that'll be working on them. So, so it just depends on the individual client and the individual patient. But I think that we do occasionally do what you would call a routine dentistry, if there was such a thing as a routine dentistry, right? But
yeah, you never know what you're going to find.
Very rare that we won't find something going on there that, with the diagnostics that we could do once they're under anesthesia.
Yeah, absolutely. So, folks, you get to make your choices. It's definitely going to be more expensive if you're paying for specialists, because these are people that have spent a lot more years taking courses, learning, teaching, researching. So it's going to cost more. But if you have an animal like my mother's dog that has a very weird thing going on and is older, high risk anesthesia, totally worth it. And I've had so many people come back to me after they've gone to a specialty center like this and say it was totally worth it. Yes, it costs 3 times more than it was going to cost at my veterinary office, but the satisfaction and peace of mind knowing that I had these specialists 100% focused. So you guys, you do like one patient at a time. It's not like there's multiple people doing multiple patients, right?
Right. Well, for a while there, I was the only dentist there. So I was kind of the rate limiting factor. But now we have 2 dentists. And so we may have 2 tables going on at the same time where our VTS and anesthesia might be doing the anesthesia on one patient. Our anesthesiologist might be doing the anesthesia on the other patient. But the anesthesiologist is there for the VTS, if she has any questions, which is nice. And so I think that, in terms of the nice thing about being in this type of practice as an employee is the number of cases that we do per day are pretty limited. And that allows us to spend a lot more time with each individual patient and each individual set of owners. And so there's a lot of education that goes on. There's a lot of, communication that goes on in terms of texting and calling and keeping owners in the loop as to what's going on, which,
Yeah.
I think that's the key for a good experience for clients, is just communicating with them.
Yeah, absolutely. Absolutely. Well, thank you very much for giving us an hour of your time. I know you are incredibly busy. I really appreciate it. How old are your 6 sons?
My oldest is just about to turn 16, so he's practicing driving in the parking lot here. And so he's the oldest. And then the youngest is 4, and they're all about 2 years apart in between. So yeah, we were going for that girl and it just didn't happen. Well, we got some good boys out of the deal, so that was good.
I remember when I pulled in to park in your parking lot, the house is kind of on one side of the driveway and the barn's across the driveway. And then there's this parking lot and there were all these bicycles lined up. And I was like, okay, like how many kids are there? There's a lot of bicycles.
Yeah.
So God bless you. 6 boys. When I bought my first house, the people that lived across the street had 7 daughters. They never got a boy either.
Somebody has to balance this out, right?
There you go. There was your balance. So yeah, I felt sorry for that father. It's like, oh man, that's a lot of women making you nuts.
Not enough bathrooms in the house, right?
I know. Well, John, thank you so much for agreeing to speak to us today. I know everybody learned a ton. This will stay up on our Facebook page so people can go back and watch it. And thank you very much for the work that you're doing. We so appreciate it. And I'm glad there are people like you in the world who love doing the research and, really diving in. So
my pleasure. Thanks so much for having me.
All righty. Everybody have a wonderful day. Bye, John.
Bye-bye.